if you have constant headache for more than several weeks, seek help. Okay. If you have lost function, for example, your eyes goes see double, or your arm is grow weaker, or your body moves without your own command. So it's like sawan, like epilepsy.
I see. All right.
So those are the signs that something is wrong with your nervous system.
Assalamualaikum and good day everyone. My name is Amalin and I will be your host for KoPiJom episode 3 today with our special guest at Tawakkal Specialist Hospital, Dr. Nor Faizal, Ahmad Bahuri, a neurosurgeon, with our topic today, the brain and beyond, stories from the frontline of neurosurgery. Without further ado, let's get started. So, being a neurosurgeon, how many years have you in this being a neurosurgeon from? Maybe you can walk through us from day one.
So I have spent about 15 years
15
studying.
years, doctor?
Right. So 5 years of medical student, 4 years of become a general surgeon, and another 5 years to become a neurosurgeon. So I have dedicated my about 15 years just to study the brain and to become a surgeon.
Being a neurosurgeon, we can always hear that everything have their own myth. So, what are some common myths about a neurosurgeon's life that you like to set straight?
So the common myth is that most patients who went into neurosurgery, they become vegetable. Okay, so dia jadi sayur. So basically that's the myth, but it depends on case to case basis. For example, my rule of thumb is that if the patient comes in walking, usually they can go back walking.
I see.
Yeah. So if the patient comes in delirious with or sometimes unconscious because of either ruptured blood vessel or severe brain swelling. So those are patients who will survive but has less human function. So if you come in walking, inshallah you go back walking. There's another myth that...
What is it?
All right. So some of my patients who had surgery, who had brain surgery, they are amazed that they can walk a day after the surgery. Yeah, they thought that they're gonna lie down on the bed for a few days.
I actually think the same.
No. So one of my patients says that, doctor, it seems that I can go back home today, which is 24 hours after the surgery. So I said, yes, you can, but people will not believe you that you just had a brain surgery. So the patient stays 48 hours so that Dhamma want to make sure that the swelling is subsided.
So there's no complication at all,
Yeah. So patient can go back home after 48 hours for specific brain surgery.
I see.
Okay, so that is the myth that I want to ensure that to those listeners who has family members who will undergo brain surgery.
Because most of them scared, hearing neurosurgeon surgery. Oh my God, that's so scary.
Yeah. So for those patients who are going for surgery, inshallah, you will go through this surgery with no problem.
Inshallah, you always, as a doctor, you always do your best, right?
Yes.
You always try to do your best. Okay, all right. So, dealing with patients, right? Like you said that within this 15 years of experience as a doctor, what maybe you can share a story of any unforgettable experience that with your patients, maybe.
The most satisfying surgery is what we call microvascular decompression for a disease called trigeminal neuralgia.
Okay, doctor.
Okay, so this is where patient comes in with facial pain, hypersensitivity to touch, and usually patient will say that their face is felt like they feel that the face been tore up or been sliced open.
Oh my God.
Okay, and they cannot speak because any movement of the mouth
It
can
hurts.
yes,
It hurts.
it hurts, and even wind, a blow of wind can cause pain. So I have a patient who came from Kedah last week,
Okay.
who has been delaying for surgery for 20 years. So she came in about 3 times in my clinic since May. So she came almost every month,
Okay.
just to review the medication, to seek confidence in
Okay.
me. So
Alright.
I told her that surgery is safe, it can be done, and you should not worry. And kebetulan, so coincidentally, last Friday, patient came into my clinic, and I have a lady who had a successful microvascular decompression surgery done in April.
Okay.
So I introduced these 2 patients, and I say, Makcik, please speak to this lady who is afraid of doing surgery.
encourage her
So the makcik counsel the patient, just do the surgery, it will be safe, and the pain will disappear.
Yes.
And we did operation on Saturday. Okay, so on Sunday,
Okay.
she is awake. She said that, why didn't I do surgery 20 years ago? Okay, so this is the most satisfying
Moment.
brain surgery for me, because I'm not gonna take any part of the brain. So the problem here is there's a compression of the nerve by the vessel. So what I did was to go in, find these 2 vessels, separate them with a piece of Teflon, and then close it back. So
I see.
So this is a very good surgery, very happy, and patient is satisfied with the surgery. So it can be done in 90 minutes. Imagine 20 years of pain can be solved
Yes.
in
In
90
like
minutes.
90 minutes only.
Yes.
My
So
God.
this is one of the best surgery that we can do as a
The
neurosurgeon.
most satisfying moment for
Yes.
you lah.
We were trained that every second matters.
Okay.
Yeah, because the brain can only survive without oxygen in less than 4 minutes. Okay, so every second counts.
Okay.
So we were trained to do this. That's why sometimes you find that some of the neurosurgeons are very strict, because we want to save the brain, we want to save the nerve. So every
Matters.
second counts. So we want the operation theatre to be fast. We want the nurses to pass the instrument fast. So sometimes I apologize to my nurses if I raise my voice, because I want it to be good for the patient.
They are the real unsung heroes, right? So maybe you can share with us all, everyone, on what is the symptoms that should not be not which can lead to neurological emergencies.
Okay. So for our viewers and listeners, my advice is simple. If you have constant headache for more than several weeks, seek help. Okay. If you have lost function, for example, your eyes see double, or your arm is grow weaker, or your body moves without your own command. So it's like sawan, like
I
epilepsy.
see. Alright.
So those are the signs that something is wrong with
With
your
you.
nervous system. So any constant headache, any loss of function, come to the hospital, come to any of the KPJ hospital, seek help, and we can diagnose, we can help by doing a scan, either CT scan or MRI, and if necessary, we will refer you to the nearest neurosurgical center within KPJ.
Okay. Doctor, we have been talking a lot on brain, neurological and all, but actually I've been seeing your TikTok juga, Doctor. Alright, that you also touch points on spine.
So as we know, the nervous system are made from the brain, and then it get connected into the
with the
spinal cord,
spine.
and then after that it goes through the spines to become the nerves that supply our hands and our legs. So
Okay.
So as a neurosurgeon, we manage the brain as well as the spinal cord. So as for me, my main interest is in the brain tumor as well as spinal cord tumor.
Okay.
So we'll open up the spinal cord and take the tumor out. There's also a condition what we call degenerative spine disease, where the spine that grow old, that entrap the nerves that coming out from the spine. What we can do as a neurosurgeon, we can alleviate any nerve entrapment either through surgery or through minimally invasive pain procedures.
Okay.
Yeah. So yes, it's connected, but if someone is asking, so which doctor should I see?
Yeah.
A spine doctor or a brain surgeon?
Okay.
You can see both.
Oh,
Doesn't
I see.
matter.
I mean, like if you have sleep disc, if you are, I mean, like what we call that?
Yes.
The
Right.
S.
So
S
the rule
spine.
here is, as long as we do not enter the dura and spinal cord, it's okay, because once we enter the dura and spinal cord, that is the territory of a neurosurgeon. Nobody else can touch the spinal cord and the brain except neurosurgeon.
From 2002 and 2025, it has been like a long journey. How has neurosurgical care changed over the years?
Right. Over the years, what I can say is that the incision is getting smaller. The craniotomy, the hole that we make on the skull, is smaller, and the precision to take out the tumor is getting higher. So smaller, better, and precise. Yeah.
Okay, because maybe like dulu you have to open like
Okay,
besar lah.
right. So we have a skull
Okay,
here.
yes.
Right. So previously, for example, if we have a tumor in this left area,
Okay.
so we're probably gonna open up the skull quite big.
Okay.
Yeah. But because of our access to image-guided surgery, we can localize the tumor precisely. Then we can make a smaller incision and a smaller opening to the skull. And with the guide of the image-guided surgery, we can precisely go and find the tumor
Oh wow.
and take out the tumor almost completely.
So like before this, when you have no like guided machines and all, you have to do it manually.
Yes, we have to manually think where is the tumor and try to go in and find it. So it is a complex
Okay.
procedure. So I have come from the manual. It's just like when driving car. Okay.
Okay.
You can drive manually, and nowadays we drive with automatic.
Yes, auto.
And previously, you have to remember all the routes to
Yes.
get into destination.
Yes.
Now you don't have to, because the AI,
Yes.
the
Waze, GPT and all.
it can guide you to the best route possible without any damage.
Wow, that's something. I mean, like it's
Yeah.
easier for you, and it's like better. I mean, like maybe like the recovery process for the patients is as well.
Correct.
Maybe maybe like lagi ni lah.
Yes.
Kan? Alright. Okay. So how have technology that you say that AI, we have AI and or improve hospital coordination through the KPJ health system that we have. It is an integrated health system that we have now influence your field as a neurosurgeon.
Yes. Okay. So technology does help us, and KPJ has invested on few equipments for so that we can perform the operation safely and faster and more precise. So
Yes.
that is what I like working here, because I have all the supports from the hospital.
Yes, we have supports. What upcoming advancements in neurosurgery are you most excited?
It is what we call image-guided surgery, and where we can locate the tumor precisely. We can locate the lesion precisely, so we can make a smaller incision, precise excision. So that is the trend in neurosurgery now.
Any like doctors that is currently in dekat medical schools and all, and maybe they would like to hear from you. What kind of education does it take to become a neurosurgeon?
Wow.
You yourself.
Okay. So
Yeah.
okay. So this should be inspiring, right?
Yeah. Yeah. This is your
Okay. So I have working in the university for 18 years before I joined Tawakkal Specialist Hospital.
Okay.
So I told my students previously, and I will tell the same thing to the medical student out there, or aspiring surgeon. Number one, if you want to get into neurosurgery, you must have discipline, and you must dedicate your you must dedicate your life to this art of neurosurgery. So that's it. So you must dedicate your life for this art.
Once you dedicated, there's nothing else will
Yeah.
take you back.
So it is a very difficult and long journey, but the moment you see patients smile after the surgery, talk and regain their function,
It's the most satisfying.
that is the most satisfying
Yeah.
feel that you're gonna get after you invested in your in learning this art of neurosurgery.
We can see that Dr. Nor Faizal here today bring us some interesting tools. So maybe Doctor, maybe can you explain with us
All right.
how do you use it? What is it?
So what we have here is a set of micro neurosurgery instrument where
Okay.
I use all this equipment in dissecting the brain. So like this is a sucker that can suck all the blood
Okay.
in the brain, and if you can focus, that you can see the tip of the sucker is very special because it can protect the brain from injury.
Okay.
So, and what I have on my hand, let's choose one instrument, which is okay. This is what we call a dissector, and
Okay.
we
Dissector.
can try to dissect. If you can see, there's a tumor inside the jelly.
All right.
Okay, so we will try to open up and slowly remove the tumor if we can. So training is very important here
Yeah.
because
That's why you have to be silent.
yes,
Yes,
I
now
have,
I know.
now you know why
Yeah.
my operation theatre need to be quiet,
Yes.
because I want to make sure that my concentration
Okay.
is not disturbed. Okay, so usually during operation I'll be talking to myself. I'll be talking to myself, and my nurses
So
will
it's
just
like-
keep quiet. So basically we want to yeah.
So it's like, yay, dah dapat.
Yep. Okay, we got the tumor.
Yes. Where is it? Where is it?
Yeah. We got the tumor.
Okay.
We got the tumor.
Yes. Oh.
Basically, these are the instruments that I use to operate on the brain. It's a tiny.
Yeah, it's so tiny. Like.
This is sharp. You can see this is sharp because sometimes we have to make a puncture. We just make a line like that.
So I believe there will be bloods everywhere, right?
No,
Like-
no,
No?
no, 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 no. They won't be. The moment you see blood, then you know you are in wrong path already.
Ah, I see.
Okay, you should not see blood.
Oh. Okay.
Yeah. Okay, so these are the instruments that I usually
Okay.
use in my operation theatre, and it looks small, but all these are expensive and exquisitely
Yeah,
made
that-
so that we can dissect the brain without damaging the normal brain. Okay, I think that's all we have for today. A short demonstration of
Alright.
brain surgery. I hope it will shed
Yes.
some. It can give new information.
It's interesting that
to
you bring
viewers.
us like a jelly and all that to show us with all the tools and all that. We really appreciate that, and thank you, Doctor, for bercerita dengan sikit dengan kita on how a neurosurgeon, how's life as a neurosurgeon. Thank you so much, Doctor. Alright, that's all everyone for today's episode 3 of KoPiJom podcast, and thank you for watching everyone. See you on another episode. Bye bye.